Hello all, this is Dr. Walter from SNS College of Physiotherapy, and today we are going to see a new topic, that is hydrocephalus. So this hydrocephalus we are going to learn under the subject clinical neurology. So you might have seen all these videos for the past 2 months. All these videos will be coming under the clinical neurological subject, and today this hydrocephalus will be a quite good interesting concept. Okay, so what we know about hydrocephalus? Hydrocephalus is a congenital disease. Okay, so this will be causing while during the baby is born. And another case study also refers that this will be happening under the circumstances for head injury and road traffic accidents. Okay, so that is acquired hydrocephalus, and this is completely coming for congenital hydrocephalus. So now we are going to see the definition and the prevalence. Now going for the definition, what is hydrocephalus? Hydrocephalus is abnormal accumulation of cerebrospinal fluid within the brain ventricles. So how many ventricles are there in the brain? There are 4 ventricles. Okay, so these 4 ventricles are responsible for the production of cerebrospinal fluid. Now accumulation of this cerebrospinal fluid onto the ventricles will be referring for the definition of the hydrocephalus. Now going for the prevalence. Prevalence means how many conditions, like how many childbirth will be affected with this hydrocephalus. Approximately 1 in 1000 live birth. If 1000 children are born in a day, and among the 1000 children, 1 children will be going for the hydrocephalus. So it is varies or based on the causes, congenital or acquired form, as I told earlier. Now going for the next slide, that is pathophysiology. Pathophysiology of the CNS. So this CSF is completely going for something. Patho means any infection or any type of injury. Now CSF production is produced by the choroid plexus within the ventricles. Okay, and circulation, it is circulated throughout all the ventricles. Okay, and absorption, it is absorbed into the bloodstream, and then it is going through the arachnoid villi. So all these things which is present inside the brain. So we might have learned already all the parts of the brain and also the innermost parts of the brain. Now etiology. So etiology, we are going for the imbalance in production, circulation, absorption, which causes hydrocephalus. So all these production, if it is going for any imbalance, or else the production is good and the absorption is going for any imbalance, causes hydrocephalus. So absorption is good, production is good, but the circulation is aberrated, and this is also going for the hydrocephalus formation, circulation and the absorption. Now we are going for the next slide, and this next slide is going for the clinical presentation. So this clinical presentation is of signs and symptoms. So what are the signs and what are the symptoms? Now infants means small children, going for rapid head growth. We might have seen in our clinical postings and all, yes or no? So the head growth will be going for a bigger surface. Okay, normal head diameter will be going for 2 to 3 above the normal diameter. Now children and adult, headache, nausea, vomiting. Headache will be occurring and the vomiting sensation, that is called the nausea, and in final stage vomiting will be occurring. And for the cognitive impact, CSF production, circulation, absorption, all these going for imbalance. The cognitive thinking, all the fine motor, gross motor, and all the thinking and concentration and the processing speed, all these will be going for a lower area. And the last one is the motor imbalance, that is by walking, that is gait disturbances, and also the poor coordination, spasticity, weakness. All these things will be occurring for the children, and this you need to understand for the children and also for the acquired. Now going for the next slide, that is the medical management. Yes. So as we are going to treat this patient, how we can able to treat. So this is going for medical management. First is a diagnosis, how to identify that this is hydrocephalus. First one is MRI, that is the most important findings of the diagnosis, and also the elongated path of the CT scans. Okay, now this is also called the ventriculoperitoneal shunt, that is VP shunt. Normally we will be saying all these terms in a short form, VP shunt. But what is it? This is a type which drains the CSF from the ventricles. So this will be helpful for the small children and also the RTA patients who are going for the hydrocephalus. This shunt will be helpful. Thus the ventricle part will be going for a stoppage and it will be going for a normal head one. And VA shunt, that is ventriculoatrial shunt. Last thing, ventricle peritoneal, and this is ventricle atrial, and this drains the CSF into heart. This one draining the CSF into abdominal cavity. Last one is endoscopic third ventriculostomy. These three things are most important and the advanced diagnostic technique. Now going for the next one, and next one is going for the physiotherapy. As we are in the physiotherapy field, we need to assess how to analyze the hydrocephalus patient. How? Neurological screening, motor skills by giving any type of things like picking up a bottle and walking. All these comes under the motor skills, balance and gait. We can make the children to walk from here to there, from this end to that end. That is also a walk training. And functional mobility. What is functional mobility? Functional mobility, from the child, all things will be normal. Like they will be playing, they will be going out. As we compare with ourselves, as we are going for an adult stage, and these are infant stage. All these things, that is daily activities, they will be very smarter than us. Yes or no? Yes. And all these things will be going for a decline. So all these things will be considered as the assessment. Now going for the next slide, that is rehabilitation strategies. First we saw about the diagnosis, surgical management, physiotherapy assessment. Now we are going to rehabilitate this patient. How? Strength training, balance exercise like wobble board exercises, these things we can use, and gait training and the flexibility. And with this we are completing the topic hydrocephalus. I hope all of you might have studied this hydrocephalus in a very good manner. Thank you.